name is Candace Blair, and this is my video submission for my overall health assessment. Before I meet my patient, I'm going to wash my hands using the hand sanitizer. Hi, Mr. Blair.
Hi.
I'm Candace. I'm going to be your nurse doing your physical assessment today.
Okay.
If at any point you become uncomfortable, you just let me know because there is a lot of touching involved.
Okay.
Can you state your date of birth for me?
10/14/1987.
And do you know where you are?
I'm in the hospital.
And do you know who the president is?
It is Barack Obama.
Okay. Patient is alert and oriented. He answers appropriately to the questions. He is presenting in an overall clean appearance. He is well put together. Okay, I'm going to touch you now, okay?
Okay.
Skin is warm. Pigmentation is even in upper and lower extremities. There is no edema noted in upper or lower extremities bilaterally. Just going to look at your nails. Nails are clean. They're well kept. They're short. Cap refill is brisk. It's less than 2 seconds. Okay, I'm just going to look at your hair now. Okay. Scalp is clean. Hair is evenly distributed. There's no signs of lesions or nodules noted on his scalp. Just going to look at your face. There's no sign of lesions or nodules noted on his face. Head is proportionate to his body. His facial symmetry is intact. It's even on both sides. His eyes are also even. There's no facial drooping whatsoever. Okay, I'm just going to palpate your temporal artery. It is strong. I'm going to listen to it with my stethoscope. I'm going to listen using the bell. Okay. There are no bruises noted. Okay. You could tilt your chin up for me. I'm going to look at your thyroid. If you could swallow for me. Okay. There's no issues there. I'm going to come behind you. And if you can swallow for me again. Okay. There are no lesions or nodules noted for his thyroid. I am going to listen. Okay. Swallow for me. While I'm here, I'm also going to listen to the carotid artery. If you can hold your breath for me. Okay, let it out. And once more. Okay. And there are no bruises noted there either. Just going to palpate them really quick. Pulses are strong bilaterally. Okay, now I'm just going to palpate your lymph nodes. Tell me if it hurts at any point. I'm going to look at your preauricular, your postauricular, your occipital, your submandibular, your submental, your superficial cervical, your deep cervical, and your supraclavicular. And there's no lymphadenopathy noted there. Okay, next I'm going to move on to the eyes. I'm going to look at the conjunctiva. If you can look up for me. Conjunctiva is pink, no drainage or lesions noted. Sclera is also white. I'm going to shine a bright light in your eye. Okay. Pupils are equally round and reactive to light. If you can focus on my pen, Mr. Blair. Accommodation is also present. Okay. Keep looking at my pen. Okay. Cardinal gaze is intact. There's no nystagmus present. Next, I'm going to look at have you stand up and read from the chart. If you can go to where I've marked it on the floor. And read the smallest line possible.
DEFPOTEC.
Okay. Patient is presenting with 20/20 vision. If you can, next we're going to check your near vision. So if you can just read the letters on this piece of paper for me, the smallest line possible.
LOPTZEDCT.
Okay. And that is normal as well. All right, Mr. Blair, you can have a seat. Next, I'm going to inspect the ears. There is no drainage present, no nodules on the tragus or auricle of the ear. Okay, next I'm going to move on to the nose. If you can cover up one nostril for me. And just tell me what you smell. Include one nostril at a time.
Alcohol?
Mm-hmm.
Alcohol.
Okay. All right. Next, I'm going to palpate your sinuses. I'm going to go to the maxillary and frontal. Any pain or tenderness?
No.
And there is no nasal drainage or discharge noted. No pain or tenderness in the sinus areas either. Okay, if you can open your mouth and say ah for me. Okay, uvula is midline. Also, the buccal mucosa area is pink and moist. No dental caries noted. Teeth are intact and well maintained. Okay. Next, Mr. Blair, I'm going to teach you how to do a self-breast exam on yourself. Many males don't do this, but it is extremely important because males are also diagnosed with breast cancer, and it also goes unnoticed. So if you can put your hand behind your head, okay, and you just go up and down. I'm also going to check the lymph nodes in your axillary as well. Okay, no issues on that side. Can you do the same? Okay, again, I'm going to go to the axillary. Okay, and there were no nodules present. Now, if you can do a return demonstration, that way I know that you know how to perform an exam on
Okay.
yourself.
Yeah, so put in my arm over my head, palpate up and down across the whole area. And the same on the other side.
Good. And you want to do this once a month.
Okay.
Move onto your chest and lungs. Patient's respiratory rate is even and unlabored. Chest wall is symmetrical and normal for his age and body type. There are no lesions or nodules present. I'm going to listen to your lungs using the diaphragm and my stethoscope. If you can just breathe in through your mouth and take a deep breath. Okay, relax for a second. I'm going to come and check. Listen posteriorly as well. Deep breath for me. And one more. Okay. Lungs are clear and even anteriorly and posteriorly bilaterally. No wheezing or anything noted. Next, I'm going to be looking at the heart. I'm going to palpate over the aortic, pulmonic, Erb's point, tricuspid, and mitral. I'm going to listen for S1 and S2, first using the diaphragm of my stethoscope. The pulmonic is at the second intercostal space on the right-hand side. The pulmonic is on the second intercostal space on the left-hand side. Erb's point is at the fourth intercostal space on the left-hand side. The tricuspid is at the fifth intercostal space on the left-hand side. And the mitral is also at the fifth intercostal space on the left-hand side. Okay, S1 and S2 are present. Next, I'm going to listen to the same points again using the valve of my stethoscope. This time, I'm listening for any bruise or heart murmurs. And again, there are no murmurs or bruise noted. Okay, next I'm going to assess your pulses. First, I'm going to start with the radials, then your brachials, already done your carotid. I'm gonna listen to your popliteal, or feel your popliteal. Your dorsal peak. So next I'm going to move on to the neuro section. The patient scored a 15 on the Glasgow-Coma scale. He answered appropriately when asked the date, time, and location. He spontaneously opened his eyes when I walked into the room. Next, I'm going to go through the cranial nerves. Some of these I've already performed. Cranial nerve 1, which is the olfactory, I performed when I tested the patency of his nasal cavities. Cranial nerves 2, the optic nerve, was tested when he did the Snelling chart. Cranial nerves 3, 4, and 6, which is the oculomotor, trochlear, and abducens, I performed with the cardinal gazes. He had no nystagmus noted. Cranial nerve 5, I'm going to have you close your eyes and you tell me if you feel.
Yeah. Okay. I'm gonna feel that.
Okay. Cranial nerve 5, which is the trigeminal nerve, is intact. Cranial nerve 7, I'm going to ask you to puff out your cheeks, raise your eyebrows, smile for me. Cranial nerve 7, which is the facial nerve, is intact. Cranial nerve 8, which is the auditory, I'm going to perform. I'm going to whisper something in your ear and you just repeat what I say.
Apple. 1, 2, 3.
Okay. Cranial nerve 8 is intact. Cranial nerve 9 and 10, I performed when I assessed his uvula. It was midline, and that is the glossopharyngeal and vagus cranial nerve. And also, cranial nerve 10 was performed when I asked him to swallow. Cranial nerve 11, which is the accessory muscle, I'm going to test. I'm going to meet resistance. You're going to meet resistance when you shrug your shoulders for me. Okay. And then meet resistance again when you turn your head from side to side. Okay. Okay. And cranial nerve 11 is intact as well. Finally, cranial nerve 12, which is the hypoglossal, I'm going to have you poke your tongue out on the side of your cheek, and you're going to meet resistance as well. Okay? Okay. And cranial nerve 12 is intact as well. Alright, next I'm going to move on to the musculoskeletal. I assessed his temporomandibular joint earlier. It was intact. No abnormalities were noted. I'm going to ask you to squeeze my fingers. Grips are strong. Okay. Grips are strong and equal bilaterally. I'm going to have you put out your feet. Like, prop them up. There you go. Okay. Now, pull against my hands. Okay. And push. Okay. Good. And those are strong and intact and equally bilaterally as well. Okay. I'm going to have you do, you're going to touch my finger and then you're going to touch your nose. Again. Other hand. Okay. And that's the finger to nose test. I'm also going to ask you to stand up and walk with your heels touching each heel. Okay. Gait is steady. No wobbling or anything. You can have a seat, Mr. Porter. Thank you.
Okay.
And then next, I'm going to have you do the rapid alternating movement. So you're just going to sit and you're just going to go like this.
Okay.
As fast as you can. Okay. Awesome. And that is intact as well. Alright. Next, Mr. Blair, we're gonna look at your abdominal region. I'm gonna ask you to lay on the couch for me. And we're gonna auscultate before we palpate his abdomen, just because it can cause vowel sounds to occur. And I'm gonna listen to his aortic, renal, and iliac arteries using the bell. I'm listening again for bruits. The aortic is in the middle of the midline of the abdomen, right above the umbilical. The renal are in the upper quadrants, right and left. And there are no bruits noted. Next, I'm just going to listen with the diaphragm, and I'm auscultating vowel sounds. Okay. And vowel sounds are present. They are normal. There's no sign of hyperactivity whatsoever. Next, I'm going to palpate. You tell me if you have any pain or tenderness. Any pain or tenderness?
No.
Well, that concludes your physical exam. You may get up and get dressed, and you're free to go.
Okay, thank you.
This concludes my video presentation. Thank you.